Episode of State of Mind is sponsored by CharterCARE Health Partners. Welcome in. We've got a big show tonight, and I'll tell you all about it after they show my name and stuff. Hey, how are you? Good Friday night to you. Good Sunday evening to you. And some of you are watching this program on a special edition on Fox Providence on Sunday night, November 8th, right after the news. Meaning, the reason I tell you that is that this program is aired and will air a couple of times because, well, it's an important one, and it's a real opportunity for you to latch on to some health information that in a space you most likely wouldn't have the opportunity to latch on to, and as much as you will have an opportunity to actually just check into just almost every aspect of how you and your family are doing. Let me put up this graphic and you'll get a sense of what we're talking about here. It'll tell you what's going on. On Saturday, November 14th, at the Twin River Event Center, you know where that is. Go play a little blackjack and then figure out, how you and the family are doing health-wise from 8:30 to noon. And it's all brought to you, as I told you at the top, by CharterCARE Health Partners. And Brett Davey is the guy who directs communications for that organization. We're going to meet three docs tonight who are going to give you some advice on certain things up here and everywhere. But this is a really cool, almost one-stop shop opportunity for people to check themselves and the family out, right?
Definitely. And
welcome to the show, by the way.
Appreciate it. As you mentioned, Saturday, November 14th, 8:30 to noon at Twin River. It's a first ever event, and we're excited to bring it to Rhode Islanders. We really think that a more well-informed population is a healthier population. It's free, as you mentioned, no RSVP necessary, and as a special incentive, the first 500 people will get a free first aid kit. So you'll walk out of Twin River with something. Could be a first aid kit, but
what's in a first aid kit these days? What's in
the
there?
same stuff that was always in a first aid kit. Exactly.
Sunblock.
Exactly.
Yeah,
but it's free.
Yeah.
But the big draw, we think, is the health information, the screenings that people are going to be able to access when they come in. Some really world-class doctors and other caregivers are going to be there, and we've also got a great lecture series that's going to take place. So, like I said, it's all free. And we really encourage people to come out and really take control of their own health care.
Talk about CharterCARE, and give me the background. You're the holding company for a couple of major institutions here in the state.
Roger Williams Medical Center and Fatima Hospital, we joined together several years ago, and we've seen a lot of growth. It's a really exciting time at CharterCARE Health Partners. We had a press conference recently to announce $17.5 million of investments in our emergency rooms and front entrances. So, but we've always felt from our individual institutions that community outreach and screening and information was a big part of what we do, and we're continuing that to this day.
The whole health education thing is such a big priority for people, and we are in such flux in the healthcare industry right now between Obamacare, the changes in the way doctors do their thing in the office. I've done a lot of programs here about kind of the evolution from the general practitioner and the methods and the ways that we access healthcare and our doctors, insurance companies mandating that you see this guy before you go see that gal. I mean, it's a heady thing right now for everyday people to try to figure out how to take care of themselves.
Well, as you know, though, people are trying to take more control of their healthcare, and they'll go online when they think they have something, and they'll use Google, which is the worst thing you can do.
Yeah, you know what? I can honestly tell you, I've never done that. Because I'm a hypochondriac. And the last thing that I'm going to do is go, oh, this hurts. I'm going to go, oh, no. My daughter does. So I have to say, you know what, get off that thing.
Well, I mentioned that because you come to the event, we've got a team of people there who are going to be doing screenings. You can meet with a dermatologist to say, hey, is this skin cancer? What is this?
Right.
You can talk to one of our cancer docs and ask questions. We have a primary care physician who's going to be there, but a whole host of nurses and technicians. You can get blood pressure screen, cholesterol, body mass index. I mean, there's a whole host of things you can do. And then we have the lecture series that's going to take place as well.
Good for families.
Great for families. We're even going to have someone making balloon animals and face painting.
Really?
Yeah.
That's cool. Kids will love that kind of stuff. Dads don't take care of themselves as much as they're supposed to, right? So you bring the family down.
Yeah.
She can grab him and say, come on, let's go down there. And it's pretty well researched that men are a little bit more hesitant in checking to the doctor on a regular basis. So this is a good way to kind of just start a conversation, get a little blood pressure check, a oh, it's 160 over
Sure.
100. I mean, you gotta go see, right?
Yeah. I mean, in the lecture
without
series
a lot of high
too.
pressure and the
Yeah.
whole in the waiting room type
Right.
of stress that people experience.
Yeah, and in the lecture series, you're going to hear about cancer, you're going to hear about diabetes, you're going to hear about mental health, elder care, weight loss surgery. So there's a whole host of topics. If someone's wife thinks that maybe they are diabetic and they're not treating it correctly, there's going to be a bunch of things you can learn about that. If you want to know more about cancer, if you want to learn about weight loss surgery, I mean, there's going to be a lot of information in a short period of time.
Do people actually check this kind of thing out because they're curious about the topic or they're worried about themselves?
It's probably a combination of both. I mean, you take something like cancer. Everyone in Rhode Island knows someone who's close to them who's had cancer at some point. I mean, we have incredible resources at the Roger Williams Cancer Center with the biggest team of surgical oncologists in the state. So there's a lot of expertise. So I think people are genuinely curious about what the latest developments are, whether it's for themselves or a loved one or just to be better informed.
All right, so we'll be showing you this graphic over and over and over again, but I'm going to put it up one more time here so that you're making a note for Saturday, depending on which night you're watching this broadcast. You figure it out in your calendar. Brett, thanks. When we come back, we're going to meet Dr. Scott Halsman, who takes care of this stuff, which, by the way, these days is an important conversation in terms of parity in health. Stay with us. So continue our conversation on this very special event coming up on Saturday, November 14th at Twin River, where CharterCARE Health Partners sponsors an opportunity for you to kind of just, you know, peruse. Look, you'll do a home show and have a whole bunch of questions for contractors and that kind of thing, and a boat show when you want to buy a boat. You probably ought to stop by a show that can teach you a lot about your health and answer some preliminary questions you may have about you or your family, your kids, whatever. So make a note of that. And amongst the folks that you'll be able to talk to are Dr. Scott Halsman, who's a psychiatrist and medical director at the Behavioral Health Facility at Fatima. Doc, welcome.
Nice to be here, Dan.
Should I lay down on the couch and talk to you about some of the things that are bothering me, or?
I'd like to start that way, and then we'll see if we need to progress beyond that and provide extra treatment for you.
How's business in the mental health care world?
Well, you know, business in the mental health care world is always active. I think it's been better over the years because we've been doing a better job at kind of taking away the stigma of mental health. Patrick Kennedy has, you know, come forward and said, hey, I've got a mental health problem. People are coming forward to talk about their substance abuse issues, their depression, their bipolar disorder. So when people in the public world come forward and say, this is an illness, it's not a matter of weak character, it's not a matter of, you know, not having enough willpower, then I think people begin to realize, hey, it's worth looking into getting some help and getting treatment for psychiatric issues.
Yeah, you know, listen, the great thing about doing programs like this is that they generate me wanting to ask the guests to come back and talk about all sorts of things, because mental health parity is such an important conversation, and it really is in a lot of ways coughing up with some of the violence issues that we've been discussing in America today, and, you know, gun control versus someone's state of mind, and all that kind of thing. And it seems like we've been forced to climb a curve to start talking about mental health on the same level as I got a busted knee or whatever.
Right.
We ain't there yet, though.
We're not. We're not. I think people have to fight for the recognition that their problem is serious, their problem is debilitating, and we know from research that that having a depression, for example, that in fact it will be the one of the most, if not the most, debilitating medical conditions in the world within the next 20 years. The major depressive disorder, because really it can take a young person that's otherwise fit and able and render that person incapacitated.
And you can't see it.
You can't see it, and you can't do blood work, you can't do an x-ray. You can try to do those tests to figure out whether it's something other than depression. Yeah. But depression is, and other psychiatric illnesses are real medical conditions.
All right, so we're coming up to the holidays. People get very stressed. There's a whole bunch of pressure. It's supposed to be, you know, Jesus and Hanukkah and all that, and it ends up being nothing but dread. It's like, if I've heard, even in my own family, maybe from myself from time to time, if I can just get through the holidays, right?
Right.
You're going to help folks at this event cope a little bit with a couple of 5-minute sessions
Right.
on about how you, a couple of quick thoughts on how you ought to think about the stress of the
Well,
holidays.
I'll be giving about a 15-minute talk if they don't take the hook and take me
Right.
out there early.
Right.
But about holiday stress, because this is a really big issue, and one of the reasons is because people will they'll believe that the holidays are supposed to be joyful and fun and pleasant. You have a very idealistic, almost Hollywood notion of what it's like to celebrate the holidays. But that almost never matches with people's reality. So in reality, often the holidays are one of the most stressful times, in part because you're expecting them to be happy. And guess what? It's the same way it was last year and the year before, which is when the family gets together, and often so many of those conflicts and issues that you didn't resolve between 1 December and the next, or 1 November and the next, start to get stirred up.
Nostalgia, missing family members.
Oh, sure.
Having lost them.
Sure.
I mean,
It's a trigger.
My parents. Now I am going to get on your couch, but my parents were both lost during the holiday season.
Yeah.
I mean, I literally had a Christmas where my mom passed away before Christmas. We buried her. We waited to bury her between the holidays. The family has come together and found
Yeah.
a way to celebrate
Right.
that. But these things are hard. Real life doesn't stop around the holidays. Is kind of the theme, right?
That's exactly right. And in fact, it's sometimes a chance to get together with family members and rebuild. But it takes shifting your attitude a little bit. You can't expect to go in there and just because you walk in your door, everyone's going to be happy. If you've got a miserable uncle that complains about his financial situation or his achy joints every single holiday that you go visit, or worse, complains about you and the fact you don't write enough, you don't send enough money, whatever it is, guess what? This time you go visit, he's going to be doing exactly the same thing. And you have to kind of learn how to kind of embrace the positives that each family member brings. The nice thing about family is they're crazy, but they're all crazy in their own way.
Right.
And they can bring something special to your holidays and to your
Isn't
life.
everybody a little crazy?
Well, I count on that to keep my business going. Yeah.
With all the notes you take and all the crazy people you see, you got to have a couple of moments. You have your
Well,
own string?
we don't use the word crazy.
Okay. In fact, you're right. I'm
Yeah.
told that it's politically incorrect these days. That we're not. It's a demeaning term.
Well,
You have to have a sense of humor about this stuff from time to time, right? You seem to have it.
Thank you. I think the issue is like a lot of folks will see me and they'll come to see me. They're anxious. They're having panic attacks. They're
Which are very real.
They're not functioning very well, but they'll say, "Doc, I just want to know I'm not crazy." And the reality is, you're not. In most cases. Now, some people will also come in and believe, they're being spied on by the CIA, or that their identity is being stolen by their next door neighbor. In that case, you're upping the ante. These people certainly struggle with reality, and that's something that also has to be addressed and can be addressed.
So this event coming up on the 14th.
Which, by the way, costs less than going to the home show or the boat show.
'Cause it's free.
It's free, exactly.
You're a marketer as well as a good head
I've gone
guy.
to those home shows and I've dished out a lot of money, so I really appreciate when I have a chance to do something that I don't have to pay for.
I'm sure in general you're going to be very informative, and you could probably have a special moment or two with some people as they're thinking about some challenges they might have. But in general, at Fatima and with healthcare in general these days, how do people go about finally saying, you know what, something's not right?
Yeah.
What do you do to get off the dime?
The place most people first go is to a family member or a loved one. But the next step is usually to a doctor. And they'll call a primary care doctor, they'll call a family member, maybe a nurse that's in the family, some type of connection with somebody that can kind of lead you through the steps. One of the problems in Rhode Island in general is there's actually a shortage of psychiatrists. So that even if I were to say, Dan, it sounds like you've got a serious problem, I know there's treatment out there for you, and if we can get you to see a psychiatrist, you'll get better. Good luck finding one. Now, the good news is that actually CharterCARE in Fatima Hospital has a day program, an outpatient program, which is much more accessible in many respects than actually calling a psychiatrist and saying, I'd like to set up an appointment.
That's good to know.
And it's a day in and day out treatment for several days or weeks in a row where you actually do either see a psychiatrist or a nurse practitioner.
And folks can learn more about that at the event on the the 14th
Absolutely.
as well. Good to see you.
Great to see you. Thanks for having me.
Some docs who take care of cancer in pretty creative ways. Next. All right, these doctors are very high level. This is a field that is going to change the world, hopefully sooner or later. Dr. Katz, who's a surgical oncologist and director of surgical immunotherapy at Roger Williams, and now his partner, who was his, what's the proper term, fellow, trainee, intern?
Surgical oncology fellow.
Fellow. Welcome to both of you. Thanks for
Thank you.
coming.
Thank you for having us.
What was it like to train under this guy?
Great. It was
Yeah?
great. Great
Yeah?
experience.
He rough you up a little bit?
A little bit.
Yeah.
Sometimes.
Yeah. I mean, is it like coaching an athlete when you're developing doctors? Do you have to, really get on them, or how does that work?
A lot of parallels, but it's all for the best.
Yes. You are going to be available as well at the health fair coming up on the 14th. We've put this up a couple of times. I want to make sure that everyone makes a note. It's a morning on a Saturday, November 14th. Very well spent. You're working on some really cool things right now. You've got a research program, I guess, that people are seeking from all over the world. Tell me about it.
So we're focused on developing novel treatments for presently incurable cancers, and we're focused on harnessing the power of the immune system. What most people and cancer patients don't realize is that within their own bodies, they have the power to destroy cancer, but cancer has ways of shutting the immune system down. So we and other institutions across the country have discovered and developed techniques and platforms to harness the power of the immune system and reprogram patients' immune cells and then give them the cells back so that they're able to fight and destroy the cancer cells. So we're able to provide patients with the ability to destroy cancer using their own immune system where they weren't able to do so by themselves.
Is this STEM type of thing related? Stem cell research-ish? Same category of concepts?
Yeah, there are some similarities. Basically what we do is we can take immune cells from any patient. So I can take the immune cells out of your body, bring them to our facility, and genetically re-engineer them or reprogram them, and then give them back to you so that these cells are now programmed to specifically target and destroy the cancer cells. So your immune system lost the ability to do that because the cancer is diabolic, it's evil, it shuts your immune system down. But now we can overcome that using this technology.
That's really, it's both fascinating and spooky at the same time.
I go with fascinating.
Yeah, I bet you do. Well, you got to be built kind of differently to be this kind of a doctor, right? Than most people who fear these conversations, right? Most people going to this fair, some of them would be dragged going, and some will be really interested. But you docs have a whole different way of thinking about disease, health challenges, all that kind of thing.
The people on the public, you're scared when you heard the word cancer.
Right.
In this first, for example, one of the most common things that we come across is, they will ask you, wait, are you saying I have cancer and I can be cured? As some people think that once you get cancer, that's it, you're done. So through education and through these health fairs is that we have that opportunity to tell them now, game's not over. These are your options. This is what you have to do. And sometimes it's actually better not to get cancer. So then there are some things that you can do to avoid that. And I guess we'll talk about that.
Well, just give me a preview.
For example, in colorectal cancer, screening colonoscopies is a way you can not only detect the cancer early, but you can also detect lesions that will become cancer. And
it's people don't want to do that. I've already had mine, and I got on the radio. It's so funny. I got on the radio the next day and said, "Look, I had a little tummy concern. I don't feel good. Let's just do this." I'm like, "Oh, great." So I go in there. I had it and didn't know I had it. They wheeled me in. I'm talking to the nurse. I'm in mid-sentence and found out that I just had a colonoscopy. It was that easy. And I came on the radio the next day and told that story, and I was told that there were hundreds of people that were scheduling, colonoscopies after I said, "Relax. This is good for you. You should do this kind of thing." Proactivity makes people nervous, but at the end or in the beginning, it's what you got to do, right?
Yeah, I mean, it's about empowerment, it's about hope, and it's about understanding that you can take charge of your own health care. So even for stage 4 colorectal cancer patients, 30, 40 years ago, that may have been a very dismal and grim prognosis, but many of these patients are actually curable, whether it's with surgery or a combination of surgery and chemotherapy or immunotherapy trials. There's tremendous hope, there's tremendous promise, and so that should motivate people to take charge of their health care.
What's happening at Roger Williams is fascinating. And, we talk a lot on this show about the things that are wrong, the politics of the day, but there's some real assets that we have in this community, and the health organizations in this community are award-winning on all levels. Most people don't know what kind of a world-winning work is being done at your place and others. Fatima, tell us about it.
So we spoke about the immunotherapy, but we have the largest cancer surgery or surgical oncology team in the state, one of the largest cancer surgery teams in New England. And what this means is that when Rhode Islanders get very complex cancers, very complex situations that require complex surgery and complex care involving medical oncology and radiation oncology, we can handle that close to home. And that's a big deal for patients, because not only does the patient not have to travel, but the family members. They don't have to go to Boston, they don't have to go to New York. They can get this care for the most complicated cancers right here in Rhode Island. And that's what we can offer patients.
Kind of a funky thing, competing in the marketplace of healthcare, isn't it? There's a credibility, there's a Hippocratic oath, there's a special way to market excellence in healthcare. It's not used car salesmen. It's not, hey, come on in, Roger Williams. You gotta do it in a high level way. This thing happening on Saturday is a way to touch people right there and
Absolutely.
explain it, right? But it is a challenge marketing how excellent a healthcare facility can be, don't you think?
It is, and we're not focused on what other people are doing. We're just focused on what we're doing. So we just want to educate people in Rhode Island about what we do and what we do well, so that they know we're here if they need us.
And we also want to take it a step further. So we're not only able to take care of the very complex cancer patients, but what we want to do is, why not have them avoid having the cancer? Why not have them change their behavior so they don't get cancer? So that's why we're now focusing on having the community educate the community so they can have the tools.
Well, what a
freak
freak show in this last couple of weeks, depending on when you've seen it. The information coming out on bacon and processed meat was enough to, okay, well, that ruined a few people's breakfast now, didn't it? But you know what? I actually pulled open the refrigerator this morning and went, okay, I can wait on that. I mean, diet, exercise, mental health, all those kinds of things are really important to this whole thing, right?
Something that is very important is the idea that you can only have cancer if you have symptoms, if you have pain, if you don't feel right. And it's very important for us in all these events to give the message that you might feel fine and you might have cancer. So there's things that you need to do. If you're a woman, you need to get your mammogram. If you're a guy or a woman, you need to get your colonoscopy, even if you feel fine.
Right.
That doc, I feel fine, I'm okay, it's not working.
No good. All right. We're going to beat this thing?
Definitely. I think we are already beating it, and we're gonna do more. But
Congratulations on your work.
Thank you.
See you on Saturday the 14th.
We'll be there. We'll be there.
We'll be right back. I want to mention again that this episode was sponsored by CharterCARE Health Partners, who are bringing you this big event happening on Saturday, November 14th. So make sure that you check it out at Twin River. If you haven't seen a doc, check into it. Thanks for watching.